Welcome back to Good Day State Line. We are at MD SkinCenter today with Dr. Stenstrom and Lucy. Thanks so much for having us again.
Thanks for coming back.
Yeah, so you guys are such a big part of this Rockford community, and you do so much here in MD SkinCenter. Tell us a little bit about it.
Yeah, so we're really just trying to meet the needs of the community with a very comprehensive approach to skin in general. So medical services, aesthetic services, surgical services. We do a lot of skin cancer treatment, but then those patients might venture into some of our more aesthetic services. So trying to be very inclusive and have people be able to have anything they need with their skin in one place.
I love that because I think one of the hardest things in the world, at least for me, is like getting from place to place and trying to figure out which appointment is, taking a hierarchy or the other one. And so the fact that you have them all under one umbrella is pretty awesome.
Yeah. So in that vein, we've been trying to expand a little bit to meet those needs a little bit more. So recently we've added Lucy, an esthetician who has joined us. And so that's been a new addition. Some new providers, Heather, which I think some people met last time we talked. She's seeing patients now, and she's been just going for it. So
yeah. All right, Lucy, tell us a little bit about what you do here.
So I'm really happy to be joining MD SkinCenter and currently doing hydrofacials. We're custom hydrofacials and platinum, and also doing dermaplaning, chemical peels, just things to a little more non-invasive in the summertime, but leading up to a little more advanced going into the fall months to help people with skin concerns.
So tell us a little bit about what a hydrofacial is. I assume there's some sort of water involved. That's what I got.
Yeah, it's a machine and it operates with serums and specialized tips to provide hydrodermabrasion, which is abrasive, but it's very gentle.
Okay.
You get a chemical peel with no downtime, you get extractions, and you get infusion of key serums that will help to rejuvenate the skin, keep those cells turning over.
And that's something that's good for all year round, whether you're going to be in the sun or not?
It is, yeah. You always want to wear sunscreen, but it's a great service all year round, yeah.
And for all skin types, right?
All skin types,
so
with no
pretty
downtime.
much anybody is a candidate, which is nice.
It sounds too like it's something that maybe if you haven't, dabbled into facials yet, or it's been a long time, like that might be one that you're like, okay, let's try this.
Easy entry point.
Yeah, I think it's going to be fun.
Once people try it, they really are hooked. It's a great alternative to a manual facial. Yeah.
And no pain.
No pain.
Well, you can't beat that.
Right.
And about how long does it take for each appointment?
It's usually half an hour to 45 minutes.
So like literally something you can fit into your day.
You could get a lunchtime hydrofacial.
Yeah. And you're glowing right away. So
you are.
Go right back to work or your event for the night and feel good about yourself.
Yeah, because sometimes some of the other procedures do, you want to get them done prior to your event, not so much the day
out
of.
accordingly with your social calendar.
Yeah.
So, yes.
That's why I love talking to you guys, because you know so much and you can really help everyone with their skin needs. And also, like, you guys have great skin. Every time I come here, I'm like, oh, I gotta come back without my makeup on, so you can do something to this. Yeah. We are gonna meet Heather in just a sec. Tell us what she's working on.
So currently she's seeing patients, so she does medical dermatology. She's been doing some cosmetics, so some Botox and fillers and things like that. But primarily she can see rashes, acne, skin cancer checks, all those types of things. So that's what she's currently doing.
All right, Heather, so last time we met you were just getting started here at MD SkinCenter. Now you're like going for it. What have you been up to?
All the things. All the things around dermatology is what I've been up to. Yeah. So no, it's awesome. I've really been enjoying it. Lots of acne, lots of rashes, which are really fun. I think I learned that from Dr. Stenstrom. And then skin exams. So been able to find a lot of things, which is good and bad.
Yeah.
So I'm happy, settling in, always learning.
And it's so important to have people in the community who are always learning, first of all, because you never want to be behind the curve when it comes to being as a patient, getting checked out, but also to know that you are here and you're excited to help someone figure out how to treat their issue, because there's nothing worse than going to see somebody with something that's bothering you and they're like, no, just like take a Tylenol.
You're good.
Yeah, that's awful. But you're like, I want to figure it out. I want to solve this mystery.
You want to figure it out, and you can't always. But I have lots of resources here.
Yeah.
Either way, and again, always learning, always reading. There's always new things occurring. So there's always going to be things that we're going to struggle to answer, but we'll try our best anyways. But it's going really well.
That's good. Yeah. And as we move into the fall season, I feel like people have a lot of changes with their skin. Is there anything that you recommend that we do as we start moving into those colder temperatures?
Yeah, there's a lot of the same. You're still going to want to do an SPF sunscreen every day on your face. you still want to add a little bit of a protectant, whether that's a vitamin C or something like that in the morning especially. I think the thing that people need to watch out for is just the dryness that can occur more in the winter. So, you know, just monitoring that, a light moisturizer, one that preferably doesn't clog the pores, it'll say non-comedogenic on it. So that's basically the gist of it.
And then come get your skin checked.
And then come get your skin checked.
This is the perfect time, of course, to give MD SkinCenter a call for literally the laundry list of things that you guys do here.
Coming up next, we are off to the newest Goodwill store here in Rockford. We're saving you all kinds of money on back-to-school shopping, and then it's game day with my nephew Anderson. We'll be right back.